Hi, I'm Eleni Tsigas, the CEO of the Preeclampsia Foundation. Who believes that something as simple as a blood pressure cuff could be life-saving? Well, in pregnant and postpartum women, it is. In the pandemic, women, of course, are continuing to get pregnant, and what we're hearing from healthcare providers all across the country is that it is affecting the way obstetric care is being provided. Both for prenatal visits as well as for postpartum visits, telehealth is replacing a lot of those visits. And that often includes those recommended 1-week postpartum visits. This means that patient education and the all-important vital signs that women are used to getting during their visits are either hampered or eliminated entirely. For preeclampsia screening and diagnosis, this is a major concern since up to 1 in 12 pregnancies is affected by preeclampsia. The most important diagnostic feature of this life-threatening disorder of pregnancy is high blood pressure. On a positive note, federal and state legislation and regulations have been optimized to better enable telehealth options during these unprecedented times. This is where the Preeclampsia Foundation has stepped up to fill a need. The Cuff Kit is an innovative program providing the highest risk, low resource women, particularly in very vulnerable settings, with home blood pressure monitoring to help manage these important indicators of maternal complications, specifically gestational hypertension, preeclampsia, HELP syndrome, and postpartum hypertension. The Cuff Kit includes a validated automatic blood pressure device, approved educational tools for how to take your blood pressure at home, important signs and symptoms that women should be aware of, how to take your own blood pressure video, a log for tracking blood pressure, and links to several apps that can do the same tracking, as well as extensive evidence-based information easily accessed online. We've prioritized Cuff Kits to the most vulnerable populations by asking providers to ensure that they are using telehealth and therefore need their women to have these blood pressure cuffs at home, and who they themselves can prioritize distribution to women with the highest risk factors, whether that be individual risk factors or population level risks. Finally, we're asking participating providers to collect a small amount of data that will help us assess the program's impact and effectiveness. For instance, women's willingness and ability to track blood pressure at home, and how often they share it with their providers, and finally, if their providers actually use that information in the care and management of their patients. Remember, blood pressure monitors are not universally reimbursed by public and private insurers, leaving many without this very, very important screening tool. Research has shown that telehealth during the COVID pandemic has become much more pervasive, making this critical resource all the more important. We've already distributed over 4,000 Cuff Kits, working with over 50 providers across the nation. Regions, particularly in regions that are already committed to the hypertension and the hypertension and pregnancy bundle and protocols. So they're already tuned into the needs of hypertensive women, or that they are settings that are participating in initiatives like the Safer Childbirth Cities initiative. You can go to our website to learn more about this program at preeclampsia.org/the-cuff-kit, or excuse me, the Cuff Project. We'll show you how to do that now. You can go to the provider's link and click on a form where you can submit your request. And we are happy to partner with any funders to bring this resource to high-risk communities. However, the Cuff Kit program doesn't end with just distributing blood pressure monitors to high-risk women. We fundamentally believe that early detection of high blood pressure in pregnancy may actually improve outcomes. And access to blood pressure measurement devices, economic hardship, or limited knowledge should not be barriers to home-based blood pressure monitoring. Every woman should be able to check her own blood pressure at home. The Cuff Project creates solutions to this problem and raises awareness of the importance of self-monitored blood pressure. Yes, our initial response is the Cuff Kit, a package of care for high-risk mothers, which includes automatic blood pressure monitors and a variety of educational tools that explain how and why to take your blood pressure, what the numbers mean, and when to seek help. We're staying in touch with healthcare providers giving Cuff Kits to their patients to ensure we're meeting the needs of our community and that this is having a positive effect on healthcare delivery. But it's more than that. We're working with researchers, clinicians, industry, and payers to carefully consider evidence-based solutions for blood pressure monitoring for all pregnant and postpartum women. Our entire Cuff program includes the following strategies. We're partnering with healthcare providers to offer the Cuff Kit to their patients as part of various telehealth solutions. As funding allows, we're offering the Cuff Kit to women in need directly from the Preeclampsia Foundation. We're collecting data and conducting analysis to ascertain the uptake and effectiveness of home blood pressure monitoring, its impact on patient self-efficacy, maternal and neonatal outcomes, and health disparities. A lot of this is going to require working with additional researchers. Based on those findings, we may need to advocate for policy changes so that self-monitored blood pressure augments existing best practices for prenatal and postpartum care. We're staying abreast of innovations in remote blood pressure monitoring, and as appropriate, we may advocate for uptake of more clinically useful and accurate, cost-effective, and user-friendly solutions. mHealth is paving the way for more options such as wearable devices and smartphone apps. We're carefully watching this space. And finally, we may need to advocate for insurance companies to cover home monitoring solutions and/or devices for pregnant and postpartum mothers. As patient advocate leaders in this space, we've secured a solid reputation with providers, researchers, legislators, and other stakeholders. But we work collaboratively to bring together the brightest minds and most zealous advocates to realize our vision of a world where hypertensive disorders of pregnancy no longer threaten the lives and well-being of mothers and their babies. The Preeclampsia Foundation has served this community for more than 20 years and is committed to providing high-risk women with sustained access to Cuff Kits during the COVID pandemic as well as beyond. There is much work to be done, though, to make this and to ensure that this happens. Thank you for this opportunity to present the Cuff Kit program to the Maternal Health Learning and Innovation Center.